Imagine this is sort of that or thyroid cartilage. There. And then remember we had that nice little membrane right through there, right? Nice little membrane. And we said yesterday that the vagus nerve is coming out of that jugular foramen, coming down, and it's going to give us some different branches. And we said one of those branches was going to be that superior laryngeal nerve. But then we said one of those nerves were going to branch off and go inside that thyrohyoid membrane. And then we said another one was going to stay external and do that. So off the vagus nerve, remember it's the superior laryngeal nerve. And then we get the internal piercing the membrane. And then we get the external that stays superficial. So one of the reasons I'm pointing this out is because on the table, it won't show you the difference between the two. I'll point to them so you can see them, and we saw them also on the model. But again, you can't necessarily see it separately on the table. So let's take a look at that. Let me clear it. Why is it not? Oh, because it's over here. I wonder if I can pull it here and it'll stay. Probably not. Okay, so let's take a look right here on the side. Tell you what, why don't we get rid of this mandible as well? Oh, and the teeth. Gotta do each one. Okay. All right, so let's take a look there. So the first thing we can see here is this long nerve that's coming out. That is the vagus nerve. Remember the vagus nerve on the right side, as we go into the subclavian artery, will come back as the recurrent laryngeal nerve. So if we hit here, we would see it there. Now, if you want to see the recurrent laryngeal nerve as it goes to the actual larynx itself, we would see it on the back. So it's coming up the back side of there. And we saw that on the model. Okay. So as we hit that superior laryngeal, let's get the right one, the right superior laryngeal nerve, you can see that it's connected here to the vagus nerve. Let's color the vagus nerve, make it nice and bright. Give that bright blue. Kind of looks like a vein. Let's not do that. Let's get maybe a bright purple. That'll work. So we can see that vagus nerve coming through there, and then when we tap that right superior laryngeal nerve, we can see that it kind of branches off into these two different sections. But unfortunately, again, on the table, it's not going to tell you the difference between the two. So you're just going to have to kind of know like which one is. All right, so let's blow that up just a little bit so we can see it. And so there in orange, the one that would be going inside the thyrohyoid membrane is the internal laryngeal, and then the one that continues down the throat. Okay, so it continues going a little more inferior. That's the one that stays external as the external laryngeal nerve. So those are all those branches through there. Remember on the left side, the left recurrent laryngeal is going to go under the arch of aorta and come back up. But really at this point, it's all structurally the same. So again, you would just see it doing the exact same thing, going to the exact same places. Okay. So the next thing we want to look at is that ganglia. And so the first thing we saw was the superior cervical ganglia, which is here at the top. Here we see a smaller, somewhat insignificant middle cervical ganglia. And again, sometimes it's there, sometimes it's not. I think it's on all the cadaver tables though. So if you look at any of them, you should see it. And of course, it's on the models. Now here we can see there's these two different ganglia that are kind of joined together. And remember yesterday we said that when they're joined together like that, that creates the stellate ganglia, which is a combination of our inferior cervical ganglia and the first thoracic ganglia. Everybody okay with the vagus nerve and those sympathetic trunks? Again, those are pretty simple, straightforward, superior, middle, inferior, no big deal. Okay, so let's take a look at that ansa cervicalis. Let's highlight that. And as we highlight the ansa cervicalis, the first thing we can see are these different contributions or these different roots that are coming through there. Remember, C1 is going to be the one that contributes the superior root of the ansa cervicalis. So as we see this right through here, that's going to be coming from C1. And so if we add the C1 root, we would actually see it coming from there, but I don't have the root on there right now. So C1 root contributes to the superior. This is actually the inferior root that we see down through here. Now, there's some nerves that are coming off of here, and we couldn't see all these nerves yesterday. So let's just take a look at this. The one that we see first, the one here at the top, that's going to be that nerve to the superior belly of the omohyoid. Remember, the next nerve that's going to come off is going to be the nerve to the sternothyroid. The next one that comes off will be the nerve to the sternohyoid. And this one, as you can see here, will be going to the inferior belly of the omohyoid. So it always occurs in that order. So again, if you just kind of count down where each one is, you know what it is, because it always happens in 1, 2, 3, 4. Does that make sense? Now, if you tag it, again, it's just going to highlight everything, and it's not going to show you the difference. I would probably tag it either here in one of these things here. I'd either tag it like on the superior loop here, or I would tag it like on this inferior loop of the ansa cervicalis. So if I tag this, I'm not looking for ansa cervicalis. Does that make sense? It's sort of like if I tag the thyroid cartilage, I'm not looking for thyroid cartilage. I'm looking for like, what is that point on that structure? Does that make sense? So if I tag one of these, don't just put ansa cervicalis.
Where did you say the inferior loop was?
The inferior what?
You said inferior loop?
We also have that other stuff, right? That's coming off of there, and we saw that already as part of that cervical plexus. But remember, we said we had that C1, C2, C3, and even C4. And we said that we have these different things that are happening. There was that C1, which is going to go here, and then branch off and give us these two. We had our superior loop, which was going to do this. C2, C3, we're going to come together, right? Make that inferior loop. But also remember, we had these structures through here. At our transverse cervical nerve, right? We had our lesser occipital nerve that's coming off the cervical plexus. We also have our greater auricular nerve, which will come off, and remember, go towards the ear. Right. And then from here, we're also going to have the supraclavicular nerves, which will come through there. So my only point in drawing that is just so that you guys can see that when you look at the cervical plexus, the ansa cervicalis is a component of that, but it's more like the cervical plexus is beyond that. So remember the ones we looked at last week, those were cutaneous superficial nerves. These that we're looking at right now are your motor ones, and typically even off like this through here, we get like our muscle fiber or our motor innervation to like our rectus capitis anterior, rectus capitis lateralis, and longus coli, and longus capitis, which we'll see in a minute. Everybody okay? With these muscles, we're not going to see on the models, so we would be getting tested on the anatomage table with these muscles specifically. So if you mark those on your sheet that way, you're welcome to do that. If we look really high up here, we can see C1 and occiput. So we can see our rectus capitis lateralis right through there. We'll get a nice bright color, tag it. Okay. If we look a little more medial here, we can see that muscle right through there, which is only going there. Highlight that guy. Through there. Now the other two, the longus coli and the longus capitis, really the only difference is where are they at. So you see this one going to the base of the skull, right through there we have our longus capitis. And then just below that, starting there at C1, we can see that longus coli. So these are muscles that we saw back in spinal anatomy for the first time. You may or may not, I don't think you talk about them at all in musculoskeletal. The thing we're seeing is a portion of the pharynx as well too. So we're seeing these muscles that are on the posterior aspect, which we don't have to know. I'm just going to point them out. These are our constrictor muscles. There's a superior, a middle, and an inferior constrictor muscle. So if I swallow, I'm activating those muscles essentially. So I can have some control over that, and then the esophagus is going to take over and continue that peristaltic wave to get all the food down into our stomach. As we look down through here, just below our thyroid cartilage, we find the thyroid gland. And again, you guys will do that in visceral diagnosis where you'll locate the thyroid gland, you'll push it off to the side, you'll palpate it to feel it, and then you'll push to the other side and do it as well too. Okay. Thyroid gland, essentially right lobe, left lobe. Here connecting in the middle is the isthmus. And then remember on the back side, we have what? What are those little glands that we have on the back? The parathyroid gland. Let's see if we have it on this one. It's only on the female. Okay. So on the back of the parathyroid gland, we can see that on the female head and neck cadaver, which is up under the male head and neck. So we'll take a look at that if we can. Now, if we look down through here, we see these muscles that we don't need, so I'm going to go ahead and get rid of those just so they don't get in our way. One muscle that we're going to see a little bit later, okay, We'll actually see that salpingopharyngeus muscle, but we're also going to see this guy as well too, which is going to be our stylopharyngeus. Again, it's going to go from your styloid process down to the pharynx, and we'll see that. I want to say it's next week. Okay, getting rid of those constrictor muscles. Let's get rid of this guy through here. Okay, and we'll bring this guy back up. So the hyoid bone would be right through here. That's what's missing through there. And so what we can see right off the bat is that epiglottis. We can see the thyrohyoid membrane. And if you look at the thyrohyoid membrane, there's that opening again for that internal laryngeal artery. And remember the internal laryngeal nerve and the superior laryngeal artery that passes through there. Okay. And then we can see that big prominence. So we see that laryngeal prominence, that big portion that's kind of sticking out right through there. And the laryngeal prominence is also known as the Adam's apple. Remember, if we kind of turn this upside down and we were to put our finger in this little notch, that's the superior thyroid notch. So that's different from the prominence, right? The prominence is the bump. The notch is the depression, okay? If we look here, we can see the lamina on this side, and then we can see the lamina on this side as well too. So we continue to turn that around. We can see the superior horn of the thyroid cartilage, and then we can see the inferior horn of the thyroid cartilage. Let's get rid of the thyroid gland. Okay. So get rid of the thyroid gland, and we can see that inferior horn just a little bit better. Now remember, in the front, up under the thyroid, we're gonna have that cricothyroid muscle, or excuse me, the cricothyroid muscle, which is there. But underneath that is where we see the cricoid cartilage. Okay, cricoid cartilage in the front is very small. As we keep going around to the back, though, it gets really big. See how it spreads out? Now, connecting that is a membrane that's separated into two different ligaments. So as we look here, we see the median cricothyroid ligament, and then below it, we see the lateral cricothyroid ligament. And on our structure list, it just lists it collectively together as the cricothyroid membrane. So it includes both of those together. So cricoid cartilage, thyroid cartilage, hyoid bone would be there. There's the two membranes that we need to see from the front. Okay, we look around to the back side. First thing we can see here are these arytenoid muscles. Remember, with the arytenoid muscles, you have the oblique arytenoid muscles, which kind of make this shape. And then up under there, you have your transverse arytenoid muscles. I told you guys, if you just put arytenoid muscle, that's fine. If you were to put the oblique for the oblique and the transverse for the transverse, that's great too. Okay, so if you want to be more specific, you can, but you don't have to be. If we look right through here, we can see that posterior cricoarytenoid muscle. All right. We really don't need that cricopharyngeus. Let's get rid of that. It's not on our list. Now, if I get rid of these two muscles, here and here, we can now see that arytenoid cartilage. And remember, at the very tip of the arytenoid cartilage, we have that corniculate cartilage. So we have the corniculate cartilage at the front. Now, if we get rid of the epiglottis, as we're kind of, well, let's look at the ligaments that are holding that in place first. So if we look right through there, we can see these two different ligaments that are holding the epiglottis essentially in place. That first one is that hyoepiglottic ligament right here. And then the one at the bottom right there, that's the thyroepiglottic ligament. Now the thyroepiglottic ligament is on your structure list. This should have been, I just didn't put it in there, and I'm not gonna make you write it on. I'll add it for next quarter. Okay, so thyroepiglottic ligament, hyoepiglottic ligament. Now, as we get rid of that, we're going to see deeper inside there. Get rid of the epiglottis, we'll get rid of that ligament through there. And now as we're looking in, we can start seeing that true vocal fold, or that true focal ligament. Let's see if we can get it right through there. Right. Now, surrounding it's going to be several different muscles. The one that's on our list that we definitely want to know is that vocalis muscle. We can see it right there. These other ones are our lateral muscles that we have through there. So we have our thyroarytenoid muscle, and then below that, we're going to have below the vocalis muscle, we'll have our lateral muscle as well too. Let's get rid of this, move that down through there, under there. And then we have our lateral cricotoroidinoid muscle. Now the only one that's inside there that's on your list is abdocalis, okay? So you can see the other ones through there, but we don't see it any better than that. All right, let's see. We can't actually see like it from the other point of view. You remember we opened up the larynx the other day and then we looked on the inside of it and we saw that lateral ventricle and the false vocal cords and the true vocal cords. Not really gonna see that on this one, but let's just double check because I think last time I was looking at the female model. Yeah, you don't really see it. So we don't have to worry about that on the table anyway. Any questions about anything here in the larynx?